Welcome back to the Now Morning Show. We are diving into a workshop for medical professionals on muscle fiber methodology. It's on from the 25th to the 27th of October. We are speaking with Andrew Frankson, the creator of muscle fiber methodology, as well as nutrition and rehabilitation specialist, Denora George. Now, Denora, we'll start with you, please. And even before we get into the methodology, just make that relationship, please, because I think when people are working on muscle and building muscle and developing, they sometimes can forget the nutritional aspect. So build that bridge for me before we get into the methodology. Thanks.
Oh, not a problem. Thanks for that question. So ideally what you want to do in training and even your normal daily living, you want to make sure that you nourish the body well. So whatever you put in is the result of what you'll get out. So you can't expect 100% when you only put in 25%. So we definitely have to look at what we eat, how we eat, when we eat, and why we're eating. We have to be mindful with those things.
And even getting into the methodology, just before we pull in Andrew, and is there something that is, what's the most different thing about this muscle
Fiber
methodology that is not necessarily run-of-the-mill?
A lot of the times when we are doing therapy and massage treatments for persons and recuperation, a lot of persons miss the muscle fiber. We look at the muscle group, the larger body, as versus looking at what is the components of the muscle fiber, and how we could relieve pain and resolve the imbalances that we have without causing undue stress and for prolonged period of time. So essentially being effective in our treatments, effective in our techniques, and doing what we need to do for our persons, basically for athletes, for the general public, persons who are hospitalized, persons who may have strokes, taking all that pathology, the neuromuscular connections involved.
And I like the fact that you talk about it's not a one-size-fits-all, and literally every body is different.
Correct.
So different people will have different contraindications. You want to use some techniques on some, but not others.
Correct.
But what are some of those things that are, well, the target audience for a methodology kind of like this?
So for this particular course, because it is so in-depth, and Andrew will be taking you from 0 to 100, anybody who is a kinesiologist, a massage therapist, a physiotherapist, a trainer, a coach, even a parent who needs to get more information about how they could help their child or their athlete or their relative to feel better. Because a lot of the times we have a lot of muscle imbalances and we don't even notice it. It's just the way how you walk, how you sit, how even you realize when you sit, you compensate to get in a comfortable position. So it's being mindful of those things. And us as persons in the medical fraternity, physiotherapists, massage therapists, we understand the anatomy and physiology, and we are able to help persons along the lines.
And being mindful, I want to be mindful and bring Andrew in. Mr. Frankson, good morning, sir. Give us a little definition, please, in terms of what is muscle fiber methodology.
Good morning. So muscle fiber methodology targets the fiber. So in the body, each muscle have various amount of fibers that do different jobs. One muscle does more than one action. So depending on how you use your body, certain fibers will be tighter than others. So instead of working the muscle the way we normally do massage therapy, in muscle fiber methodology, we target the muscle fibers that are tighter than others. And this is done by moving the appendages of the body and manipulating the muscles accordingly. So depending on how we use our body, we tend to abuse certain fibers more than others, creating an imbalance in the body and in the muscle. So in muscle fiber methodology, it's all about the fibers, how you use your body, the imbalances that you have going on at that particular time. Whatever diagnosis, muscle fiber methodology can assist.
And I'm glad you say that because, as you said, different practices would call for different muscle groups to develop in different ways. So somebody might have the traps stiff like board. Some people, it may be the iliotibial band. And looking at the fact that it's the 27th to, well, 25th, 26th, 27th, who are the people, what's the cohort that you want to say, okay, well, this is a workshop that you need to be a part of, Mr. Frankson?
Okay, so on the 25th is the muscle fiber methodology passive stretching workshop. This methodology is mostly trainers, coaches, physiotherapists, doctors, which I've had a few doctors pass through my workshops. And the passive stretching is used to correct muscle imbalances. Just by stretching on someone fully dressed, they don't need to take anything off.
Yeah,
And there are simple, basic terminologies that we focus on: the muscle spindles, end feel, and working with the client's relaxed body. Because the more relaxed the client is, the quicker the muscle relaxes and let go. On the 26th and 27th, we go now into manipulation of the muscle fibers, targeting the different muscle fibers. And the most important is that these methods are done with the therapist sitting on a rolling stool. So in massage therapy, or even any healthcare profession, we as healthcare professionals tend to hurt ourselves looking after our clients. So I'm also teaching them how to protect their bodies at the same time while assisting their clients.
And thank
So
you for
all
that.
healthcare professionals can attend both workshops.
Okay, great. And with that, I also want to know, Ms. George, is it that somebody can take this and add it to their toolkit? Can it be integrated with other modalities? And does that person need to know massage therapy from the get-go?
Definitely. So you could definitely add this to your toolkit and to your certification. Persons, because this course is so in-depth and he's starting from baseline to carry you straight through, you don't necessarily have to know or be a massage therapist, but it's recommended that you have the basic understanding of anatomy and physiology and biology.
And I like the fact that there's a level of certification as well, because especially if you're doing continuous education units, and you always want to have your certificates available for people to see, to say, okay, well, yes, you really know what you're doing.
Exactly.
So, but is there any follow-up? Is there any sort of, and I just mentioned CEUs. So are there different levels to it, or is that you go to one and you'll be getting everything you need to be able to go forward with this sort of methodology? So
for the passive stretches, which is on Friday, persons would be able to earn 6 continuing education units. And on the Saturday, they do the 2-day workshop. Persons will be able to walk away or earn 16 continuing educations. And they could use that to expand on their portfolio as well as to add to their licensure. I know a lot of the times we have to provide a certain amount of continuing educations to renew our licensure. So yes. And this is certified by the NCT, the National Council for Therapeutic Massage and Bodywork certification.
I'm glad, because that's a question that people ask me. Where they getting permission from? Who licensing them?
Definitely.
Who's saying they can operate? And especially how it is things go in. And with that in mind, though, Mr. Frankson, is there any pushback that you've gotten, or what has the feedback been from other professionals when you say, okay, well, this is a methodology that I've come up with and it helps? What has feedback been, not just from clients, but from other professionals in the field?
Okay, so a lot of physiotherapists in Jamaica are now using my passive stretches to help to apply with what they already know with their clients. And there's a lot of my physios have been interviewed and CVM in Jamaica. Their hands are full with clients because they are now added something new and different that works. The doctors I know who have come to my classes, they are also sending their clients to other massage therapists and physios who know my methodologies, because they have been exposed to something that actually works, and they are making sure that their clients are benefiting from muscle fiber methodology.
Okay, thank you so much. And I asked Mr. Frankson about professionals. Let me ask you, Ms. George, about clients. What have they said when you introduce that? And I also want you to define passive stretching for me, please.
Sure, not a problem. So passive stretches is basically a form of static stretching where you hold the person in position for probably say 5 to 10 seconds, but you also apply pressure and they give you resistance. So you actively working the muscle to relieve the muscle. So it's a technique that a lot of us would use, the massage therapists, the physiotherapists, especially physiotherapists with their treatments of persons. And persons, once they realize that you are certified, you know what you're doing, and you're not giving them a 6 for a 9, they're definitely going to come back and they're definitely going to see the release. And they will have that prolonged period. Sometimes you'll go and get a treatment done, and probably within 24 hours, as they would say, it work out. So once you know what you're doing and the treatment is done efficiently and effectively, the persons will definitely see the long-term results as we anticipate.
And are there things that people can take away? Because yes, it's one thing to say, okay, well, the therapist, they have the methodology, they have the things in the toolkit. Are there things that you can also give to the client so that they can do on their own, a little homework as it were?
Definitely. It's always good because it's not just to come and do a massage treatment or go to the physiotherapist and do a treatment. Well, you have to be compliant. You have to do certain stretches and certain exercises to make sure that you elongate the muscle, making sure that the muscle is at the same length that it is supposed to be at, as well as to strengthen the muscle. So you're strengthening and conditioning the muscle so that it reduces the risk of that injury or imbalancing reoccurring. So it's just a method of you working with us and we working with you to make sure that you have the best body that you could work with on a daily basis. So yes, you definitely have to do your homework.
And with that, we have about 30 seconds for you, Mr. Frankson, and followed by 30 seconds for you, Ms. George, in terms of your closing comments with regard to this workshop that you're just having available to the individuals who are looking at this conversation. Mr. Frankson, your 30 seconds, sir.
Yes, so muscle fiber methodology is recognized internationally because it is board approved by NCBTMB. This certificate that the participants will be receiving can be used as CEs anywhere that they go.
Thank you so much. Ms. George.
I'm happy that we have our Caribbean brother, Mr. Frankson is from Jamaica, and he's coming back to Trinidad and Tobago to give what he would have copyright. So we are getting to be exposed by his methodology, and I would like us to take advantage of it, definitely. So we are looking forward to seeing you all there this weekend.
And thank you so much once more, Denora George, nutrition and rehabilitation specialist, as well as Andrew Frankson, creator of the Muscle Fiber Methodology, a workshop for medical professionals on muscle fiber methodology, 25th to the 27th of October.